Hello everyone, this is Dr. AZ and I'm so happy to meet you today on my birthday. And I'm so grateful to tell you that I finished 1 year as a member of the Royal College of Surgeons. So today I'm going to discuss with you a very important station. It's about a phone call, okay? And phone call stations are usually an approved success station. So if you get to this station, you want to get the 20 marks, all of them, okay, in case that the examination has 18 stations. And there are many reasons for that. First of all, number one, this is an open book station or open book exam in this station, okay? This is the first point that you want to know. It's an open book station. So there is nothing to be done here from your side other than focus. You want to know what you are going to do or to know the way or the method by which you can solve this station and you will pass it. You will get the full mark, okay? Secondly, and the second reason why it is considered as a guaranteed station for you to succeed is that it examines the attitude, okay, of the candidate, because everything is there. You do not need to tell information here. Everything is there, okay? You will get in an office, okay, and you will find all the information. So they are not examining your information, only your information. They will ask you some questions, definitely, but it is examining your attitude. So you need to have something like a paradigm, okay, that will help you. When you get to this station, you do not need to think. And in addition to that, you want to know some scenarios that are common in this station that you do not need to think, because you will be so panicked if you find something strange for you. Okay. Anyway, if you feel that you are benefiting from the information that I'm giving here, you can subscribe, okay, to this channel. And always, as you know, my channel is Dr. AZ. Okay. Well, let us go to the next page here. And this page is going to tell you about the paradigm that I told you about. So first of all, as I told you before, okay, this station is a two-parts station. The first part is the preparation station, or it is not a station, but you are going to prepare yourself. They are going to send you to a room. There is a scenario outside about the patient, and you are going to get inside. And when you get inside, you are going to sit on a table, and you will find a big file, a truly big file, and you are going to find the phone there. In some cases, in some centers, you may not find the phone because they are going to send you to the examiner, and there will be some sheet between you and the examiner, but this is not common, I think. But for us in EDEMPRO, for example, this station, you will be in an office with a phone, and you are acting formally, and the examiner also is doing the same. So you are going in these 9 minutes to read the file. Actually, this is a very short period for you to read all this information about, unless you have an idea about what you are expecting. Okay, so this is what we are doing in this channel here. The second part is the questions part, and the what will happen. This is the exam where you are going to get the marks. Okay. Anyway, I'm going to tell you this paradigm. Put it in your mind about this phone call station. And the first step is that you are going to you entered there in these 9 minutes. You read the scenario and you read the file and everything. And now you are going to call. You made the call. You called the senior or the one who you are going to refer the patient to. And the first step you are going to do some greetings, okay, and you are going to tell about yourself, okay, and you are going to tell about your position if it is written in the file or on the question outside, maybe SHO or ST3 or something like that. In most of the cases, there will be no description for you, okay? And if there is no description for you, you are going to tell that I'm one of the candidates of the exam. He's acting, but he knows that you are in the exam and he's the examiner, so there is no problem, okay? And finally, you are going to tell a brief, okay, about your patient. And the target of this brief is excitement, okay? You are calling somebody and he's your senior. He is a busy, angry man or lady who do not need more responsibilities. So you want to excite him that he wants to listen to you. Okay, you want to be sure that he is going to listen to you. So you are going to tell him something about the patient. Definitely you are going to excite him about the patient. And you are going to tell something that is so serious that will let him ask you to summarize your case. Okay? Well, the second step, the first step, okay? Always remember, the first step, okay? In all the stations of the phone call station, this will not change, okay? Well, the second step here is that you are going to, now you will do this step, he is going to tell you that summarize, okay? This is the secret word. Summarize, you are going to step 2. So in step 2, you are going to tell the following. You are going to tell clinical things. You are going to tell history. Your history, it is written in the file. Don't tell anything outside the file, okay? You are going to tell your examination. You are going to tell your labs written in the file. Radiological studies are done in the file. And the true reason, and let me write this in another color because this is the true reason for referral. Okay, actually the true reason for referral is not that exciting, you know. Usually it is you do not have a CT scan working there, your consultant is not available, something like that. So if he receive all this information and after that you tell him that we do not have CT, he has no way to escape the responsibility or refuse the case. And this is the point here. How can you convince him to take your case? This is the point, okay? Okay, so the third point here is that the examiner is going to ask you some questions. You are going to put some responsibility on him, so he is going to ask now, and you have to respond, fine? So our first scenario that we are going to tell to discuss, because this is a common station, it comes in this scenario in the file that you are going to find. And when you open the file, you have only 9 minutes. You want to know everything and do everything fast. So the first thing is that they are going to tell you that there is a polytraumatized patient, and this polytraumatized patient is post MVA or post RTA motorcyclist. His age is so and so, and this patient presented with low BP, high pulse rate, and he has a swollen thigh, right or left, whatever. And you did your investigations, his hemoglobin is low. All this is in the file. Don't tell anything outside the file. I'm telling the information that you are going to find in the file, or so close to it, okay? So he's acidotic, these informations that tell you about some shock or something like that. And they are going to tell you that the most important point is that they are going to tell you that we did an X-ray and we found, I will write this in another color, I don't know where can I write it, but let me find something here. You will find in the X-ray a widened mediastinum. Will you find other abnormalities in the X-rays? Yes, you will, but this is the secret word that will open the gates for you. So when you find widened mediastinum, remember this lecture, okay? This is the station that I'm speaking about now, okay? And this is the scenario, fine? Well, in this scenario also they are going to tell you that the CT scan will be off for 3 hours, so that you need to do CT also, and this patient is unstable, and you inserted a drain, chest drain in your management, and he passed 200 ml or cc or 250 cc of fresh blood, okay, from his chest. So this is about the scenario here, okay. So let us go to the paradigm. This what I told you now is that what you are going to find on the door. I didn't write it here because you will find it in your step 2. It is written here, okay. So let us go. Fine. Okay. So first step, you are going to do the greetings, right? Okay. So hello, you are going to tell your true name here. Fine. I'm Dr. So-and-so, and tell your position. If it is not there, you are going to tell that I'm one of the candidates of the exam, okay? So this is the greeting point, okay? Well, the first point. The second point, you are going to tell the purpose of your call. You will not tell this point, definitely. You are going to do, I'm calling to speak to Mr. or to Dr. whoever the name is they are giving, maybe Mr. Black mostly. No, you will be working for Mr. Black mostly, but I think they will tell you about somebody else who is the cardiothoracic surgeon, okay? A cardiothoracic, I'm calling to speak to Mr. or Dr. So-and-so, the cardiothoracic consultant, to accept a referral of a polytraumatized patient, okay, with a widened mediastinum on the X-ray. This is the point here. Are you getting me now? So you made your greetings, you told your position, you made your purpose that you want to speak to somebody about a case of you are going to speak to somebody with this position, for example, cardiothoracic surgeon, and you are going to excite him. How can you excite him? You are going to excite him from the scenario outside or from the file. He has a widened mediastinum on the X-ray. This means that there is something wrong, a great something wrong, a very bad thing going here. Okay, so now he will be excited. So this is the second point. What is the third point? Third point is that you are going to is confirmation. Confirmation about whom? About the senior. Who is he? Is he the one you are calling or not? So could I check that I'm speaking to Mr. So-and-so? So these are the steps. Hello, I'm Dr. So-and-so. I'm a candidate for the exam, and I'm calling to speak to Mr. Cardiothoracic surgeon to accept a referral of a polytraumatized patient with a widened mediastinum on the X-ray. So here, this is the point. Could I check that I'm speaking to Mr. So-and-so? At this point, if you excite him enough, he's going to tell you that summarize your case. He's not going to tell you that I'm Dr. So-and-so. He has no time, okay? So he's going to tell you that summarize your case. At this point here, you will guarantee the marks at this part, the first step, okay? So let us go to the second step. Second step is, we told that it is the step in which you are going to tell your scenario. You are going to speak about your patient, okay? So here, this is what you are going to find in the file, and this is these are the information about the patient. So you are going to tell it is history and examination and labs and radio. Usually a man aged something here, let's say 45 for example, okay, came to us after a motorcycle RTA. Okay, this is the history. Finished? History. Okay. On examination, his GCS is like that. You are a surgeon. His pulse rate is 120, tachycardic. His BP is 100/80, slightly low, and he has swollen left leg. Okay, all this is on the file in this order. No need to add anything. Okay, you finished your history and examination. Now we are going to the chest X-ray. Revealed widened mediastinum, and you can actually use your pen there. You will find the pen there and you can use it, no problem, okay? Or pencil or something like that. I think that you can, or you can use a paper outside and take the important information. But anyway, you do not need that if you focus in this, what I'm telling here. And please, if you focus well, I think that you will not have any problems, okay? So a widened mediastinum with bilateral hemothorax, we put a chest drain and it drained 200 cc. That means there is a major bleeding inside of fresh blood. Okay, so this patient most probably needs thoracotomy, right? So we could not make CT scan, and this is your true reason for referral. We could not make CT as the machine is being serviced for the next 3 hours. Okay, so you are not sure about your diagnosis, but it is enough. If you have widened mediastinum, you want to refer the patient to thoracic surgeon, cardiothoracic surgeon, okay? But this is the true reason here. It is hidden inside your endorsement of information to the senior or the one you are referring to, the consultant, okay? Well, now you told your major X-ray finding, then you have abdominal X-ray. There is absence of shadow. As I told you, there are other findings, but this is the most exciting, this widened. This is fatal. All are fatal, but this will kill him soon, okay? This one. So absence of shadow. And X-ray of the femur showed the fracture of the shaft, no problem, okay? His bloods, the hemoglobin is low, 8.9, the pH acidotic, bicarb is low, and the patient is diabetic, okay? We started resuscitation. You are going to tell your management according to the file. By 4 liters of crystalloids, we cross-match 6 units of blood, but not yet transfused. These are the information. This is the information that you are going to tell to the examiner. Okay. So if you do it according to the file in this way, this do not need any smartness. You do not need to be intelligent to do this. Okay. Tell it according to the file. Okay. So this is file information, nothing more. Okay. Read it according to that, but know the order because it is a big file. Know the information that you are going to take from the file. So we are going now to the last step. Okay. The last step is the questions, and the marks here are same as there in these two parts, but you want to answer these questions. So the first question, they are actually simple questions. What are you going to do for the cervical spine? Is the first thing. Okay. So you are going to tell that I will support it using a heart collar. It's simple, I think. What will you do for the leg? I will use Thomas splint. He may ask you that don't you think that an orthopedist needs to see this patient before sending the patient to me? You are going to tell that no, because widening mediastinum is a bad sign, that may be more urgent. Okay. What will you do for the blood pressure? Okay, you are going to tell that we started fluid yesterday and you told her already about that. Okay, we cross-match blood and we are going to give it, but we should not let, this is the point here that will give you high marks. Okay, we should not let because the bleeding may be from the aorta, so you do not need to raise the blood pressure, okay, for the fear of increased hemorrhage. Well, okay, he's going to ask you why having metabolic acidosis, and here there are 3 reasons. First of all, this patient may be having rhabdomyolysis due to compartment syndrome of the swollen leg. Okay. Okay. The second reason that the patient has hemorrhage, so maybe he has the first cause. Second is that he has hemorrhagic shock. Okay. And the third reason that the patient is a known case of diabetes, so maybe he's diabetic. Okay. Maybe this is ketoacidosis is the third reason. Okay, so the first reason for the acidosis is maybe compartment syndrome, rhabdomyolysis. The second reason may be this hemorrhagic shock, and the third reason is ketoacidosis. Nobody is going to ask you about the details, why compartment syndrome did that. This is another station, okay, not here. Well, what about the abdomen? You remember that you told him there is absent psoas shadow, okay? This means that there is an intra-abdominal collection. So this patient may need laparotomy. At this point here, he might ask you a question. Do you think that the general surgeon may do this operation to the patient before you send it to me? You are going to do it. No, I think that the widened mediastinum, where is it? It is not here, but it is in the other page. But the widened mediastinum is more widened mediastinum, and the fresh blood that came from the drain. Okay. Well, who will accompany the case? And here you are going to tell that I will come with one of our anesthesia colleagues or ITU colleagues. And when you tell that I will come, at that point you get the pass. Why? Because you are a very keen doctor. So this is the station. I'm going to see you in the next station, and thank you very much.